Hi, this is Dr. K, a psychologist and researcher, and today I want to talk about depression. So let's start. So, depression is one of the most common mental disorders worldwide. It is characterized by low mood and loss of pleasure or interest in activities that usually bring us joy. However, it is crucial to distinguish depressive symptoms from regular everyday mood swings because this is absolutely normal to feel sad sometimes because we go through different life phases. We experience losses, we experience breakdowns, ups and downs, but not all phases of low mood are classified as depression. During a depressive episode, you may feel downcast, you may feel irritable, or experience a diminished interest or pleasure in usual activities. But this must persist for the majority of each day over a span of at least 2 weeks. So feeling down for 3 or 5 days, or even a week, may occur anytime. However, if this continues without improvement, it should draw your attention, and if it lasts for over 2 weeks, it is definitely a reason to seek help. And the symptoms of depression may vary, and not all symptoms are present in all people with depression, but there are some common symptoms that usually occur. And well, this variation can be attributed to our personalities, our experiences, as well as the cultural background and even our surroundings. So this can vary. However, these several symptoms can be identified alongside depressed mood. So besides feeling sad and empty, we can experience poor concentration. So this is number one. And this means that, for instance, you try to read something and you cannot totally concentrate on this. You read one sentence 5 times and still don't understand what you read. This is very common. Or you go to the grocery store, and even though you usually did not have a problem with memorizing a shopping list, now you can recall even one item you were to buy. So these are usually the first symptoms of poor concentration in depression. You may also experience feelings of guilt or feeling of low self-worth, and this is highly individualized. But the majority of patients say that they feel guilty and they blame themselves for other people's failures, even though objectively they didn't have much to do with it. It may start small. I remember the patient who started to stay at work longer for an hour and then for 2 hours, but he completely didn't link it to lower mood. He just explained that he had a lot of work, just it. But after a few weeks, he realized that there was not a problem with a lot of work because he had pretty much the same amount of work that he used to have. But he realized that he started to care about everybody's work and started to blame himself and only himself for the criticism that the team gained. So something that wasn't linked to depression itself turned out to be one of the first symptoms. Also, hopelessness about the future is a very common symptom. This happens in almost all patients, and sometimes it's described as a tunnel vision, meaning that you can't see the broader picture and you focus only on the very narrow point. And in this case, you see no way out, so you may feel like you would never find a new job if you lost one. Or you may never find a new partner if you broke up with the previous. Or you would never heal if you get diagnosed with a several illness. And normally, after the first breakdown, because those are the situations when you have the right to be broken down. It's normal. But after the first breakdown, people start to look for new options. So, or they're trying to think up some new ways to make things better. But not people who are in depression. In this case, you not only stop actively doing something to make the situation better, but you also don't believe that any better path is possible. And usually you focus on how bad it is and fall into this dark hole of hopelessness. And this is very, very tough to get out of this and start seeing new opportunities. So, hopelessness about the future is often accompanied with thoughts about dying or suicide. And it's probably one of the most common symptoms related to depression. So suicide thoughts and suicidal actions. However, lack of this doesn't mean that depression is not present. No. But is not everybody experienced that. But suicidal ideations are probably the most common symptoms. That when we think about depression, these are the first things that pops in mind. And suicidal ideations are absolutely alarming, and these are symptoms that should be managed immediately. So do not hesitate to see a doctor if it happens to you, or do not hesitate to send someone to a doctor if it happens to someone you know. Also, one of the first symptoms reported by patients is disrupted sleep. And this might be a symptom which occur before any other symptoms are present. So when nothing else happens, usually disrupted sleep is already present. And now, troubles with sleep may include troubles with falling asleep. So you may find yourself lying in bed, tossing and turning for hours before you fall asleep, or you will never fall asleep that night. Your sleep might be disrupted throughout the night. So, for example, you wake up often, or your sleep is very shallow, so you can be easily woken up. And finally, disrupted sleep may mean that you wake up quite early. So, for example, normally you should wake up about 8 a.m. And if depression starts, you wake up about 3 a.m. or 4 a.m. and you can't fall asleep again. And this is not a one-time situation. It's not related to some stressful situation that you experienced on the day before, or some difficult exam that you have in some time. And this is the situation that stresses you and this disrupts your sleep. No, in depression, no matter what's going on, you wake up early, so long before you should wake up. And this is not a one-time situation that happens on and on and on again. And it's also not because you're tired, not because of alcohol, it's not because of loud surrounding, because you live next to the central station. No, this happens regardless, anything like that. And speaking of alcohol, I noticed some people try to alleviate the depressive symptoms and disrupted sleep by drinking a bit of alcohol before going to bed. But this is honestly terrible idea. Like, really, this is very, very, very bad idea, because alcohol indeed helps us to fall asleep. But after you drink alcohol, your sleep, you don't get a deep REM phase. So, and deep sleeping phase is crucial for an effective rest. So with alcohol, your sleep will be, you will fall asleep faster, but your sleep itself will be even more disrupted, and you will wake up tired anyway. So alcohol is definitely not a good idea. Some people also experience changes in appetite or weight. So you may have low appetite, lower than usually. And sometimes it can be related with the previous symptom, which was loss of interest or loss of pleasure. So even if you enjoyed some food before you're depressed, you wouldn't enjoy that much, or you wouldn't enjoy it at all. But even regardless of this loss of interest, some people with depressive symptoms may lose weight or gain weight. It can be either way, without wanting to. So you may not plan losing weight or gaining weight, but it happens anyway. And finally, one of the very common symptoms of depression is feeling low or energy, or feeling tired. And if you feel constantly tired, no matter how much you rest, no matter how much you sleep, you are still tired. And this is not related to the huge workload or physical or mental work you're doing. If nothing changed in your lifestyle and you start feeling tired, this might be a symptom to observe. And if it doesn't change, maybe it's a good idea to seek some help. Because on one hand, this can be related to, for example, low vitamin. So it's always good idea to ask your GP to do some lab test. But on the other hand, this can be related to depression, which starts. So maybe if your lab tests are okay, if you're generally healthy, maybe it's a good idea to consult it with a mental health specialist. And in addition, I think it's worth mentioning here, because when it comes to depression in children, it might look a bit different than depression in adult people. And I'm not an expert in child psychiatry, but I think that one thing worth knowing is that depression in young people may be related to more aggressive behavior. So children may not experience low mood and loss of interest, but they can experience aggressive behavior instead. And as I'm saying, I'm not an expert in child psychiatry, but this is one thing that I have been always taught to remember, that depression in children is related to aggression and irritation, not always or not only with lower mood. And depression arises from a complex interplay of social, psychological, and biological elements. And those individuals who have faced challenging life circumstances like job loss, loss of a loved one, or traumatic incidents like rape or flood are at higher risk of developing depression. And this condition can exacerbate stress and dysfunction, and further deteriorating both people's life and depression. And because our coping abilities are like a bridge, and I like this metaphor, that our coping abilities are like a bridge, so it can be solid and hold tremendous amount of weight, but one car too much and it will collapse. And we operate in the similar manner. Human can cope with a lot of things. We can survive enormous traumatic events. But there comes a time when one more argument or one more failure and this bridge collapses. And moreover, depression intertwines closely with physical well-being. And funny thing is that ancient Greeks wrote about depression in people who were physically inactive. So long time ago, ages ago, they already knew that. And many factors influencing depression, such as lack of physical activity or excessive alcohol consumption, they also pose risk for diseases like, for example, cardiovascular issues or cancer or diabetes and so on. And conversely, people with these illnesses may find themselves susceptible to depression due to challenges of managing their health condition. So this is a two-way street. Everything is related with each other. Okay, so if we know what depression is, now we can talk a bit about how to fight it. Effective treatments for depression are available, and they can include psychological interventions and medications. And mix of them both, so psychological interventions like therapy and medications, they are considered the most effective way of treatment for depression, and especially in the case of moderate and severe depression, because mild depression typically doesn't require medication, but sometimes, not always, but sometimes light medications may be introduced if patients have troubles finding motivation to stay in therapy. So it's sometimes very helpful. But typically, both psychiatrists and therapists recommend starting mild depression treatment without medication. And you should be aware that it takes some time for medications to start working, and typically it takes about 2 weeks before you feel better, before you feel any better. And patients often ask about side effects of antidepressants. And there are some side effects, so we must be aware of this. Especially during first days, you can experience side effects, and they can include feeling shaky or anxious, generally feeling sick. So you can feel that, well, you don't feel good, generally speaking. They can include stomach aches or constipation, or dizziness or headaches, and last but not least, sexual dysfunctions. Especially sexual dysfunctions related to achieving orgasm and maintaining erection. And if these issues persist and they are problematic to you, you may talk to your doctor about changing medication, because there are different group of drugs for depression, so your doctor can find the most suitable for you if some of side effects are especially troubling to you. When it comes to psychological therapies, they aim to instill new coping mechanisms through patterns and interpersonal skills. So not only they aim to help you right now, but they also aim to teach you how to cope in the future, so that you will have more effective strategies to manage upcoming problems, not only those you have right now. And there are different types of therapies, of course. However, the most effective and most recommended is cognitive behavioral therapy, because it is evidence-based therapy. So we know that it works. And this therapy focuses on changing ineffective thinking patterns and maladaptive schemes. So if you have maladaptive schemes and you don't work on them, no matter how much time you spend on treating depression, the depression will come again. And we don't want recurrent depression episodes. Of course, they will happen. At least in some patients, they will happen, because depression is lifetime illness. So if it happened once, this may happen second time, third time, and so on. But if you work on schemes, you are decreasing the risk of another depressive episode. So this is definitely something that's worth working on. And to summarize, I'd like to add a few words about supporting people with depression. Because when someone close to us is suffering, we usually want to help them as soon as possible. And sometimes seeing people suffering makes us want to take their pain away. And I know it. And we would better suffer for them. We would do anything to help them. And we want to use any strategies that we have to support them. But telling someone that don't worry, or it will be okay, or look at people in worse positions, they do not complain, this is not a good idea. Saying things like that wouldn't help them at all. It can cause even more suffering. So no matter how much you want, don't try to reduce the suffering by saying things like that. If you want to help someone with depression, you should know that sometimes just being present and simply being around someone is more effective than saying anything. And just being present brings more support than quasi-motivation talks. So if you want to help people with depression, ask this person what you can do, what they need. And if they don't need something right now, or because possibly they will tell you that no, they don't need anything, just tell them, assure them that you are for them anytime they need you. And make sure they remember about it. So send them a message that you are there. Send them a message that you're thinking about them. I wouldn't write that I'm worried about them, because if you're worried about them, they would be worried that you are worried, and so on. So this is going to be the vicious circle. But just drop them a message that you're thinking about them, that you remember about them, and if they only can, if they only want to, you are there to be a crying shoulder. And if they only want, you can go for a walk without saying anything. And trust me, this works.